GP leaders will vote later this month on whether they should charge patients up to £25 for appointments. It comes as doctors in general practice across our region say they're suffering so much stress, something has to be done to manage their workloads. I'm joined now by our health correspondent, Michele Paduano. So, Michele, where has this idea of charging for appointments come from?
Well, from local medical committees. These are the groups who look after the rights of GPs, and they'll have a meeting later this month where they'll vote on this particular issue. Now, the Birmingham LMC isn't in favour of this, but it says that it's seen lots of its GPs retiring early or emigrating, and it understands why people are thinking in this particular way.
Unfortunately, the government doesn't seem to be doing anything to manage demand on general practice, in fact, quite the opposite. And so inevitably, at times of great stress like this, the idea of charging patients just as a means of trying to give the service time to spend more with the patients that really needs it rears its head.
Does this idea have much support amongst GPs, though?
Well, there's only been one survey, and in that survey, just over half of GPs were actually in favour, but most of the GPs I've canvassed tonight said they didn't think it was a good idea. It would mean more pressure on hospitals, and it would impact on the poorest people in the community worst. Most of all, though, patients, I don't think, would like it very much.
I agree with it if it's people that aren't going to their appointment, because it's kind of wasting GP time, and also they do that with the dentists, well, some dentists anyway, but not to go see them in general. Like, it kind of goes against what NHS stands for.
So it's the people who work that will end up having to pay, because people on benefits don't have to pay nothing. And I think I pay enough taxes as it is, so I shouldn't have to pay to see my GP.
Well, it's definitely a no there. How likely is it to happen?
Well, these local medical committees are political, and what they're really angling for is more money to come into general practice. And as you said there, it's not a vote in amongst the public, and I can't see any government actually agreeing to this a year before a general election.
OK, Michele Paduano, thank you.